Hello, everyone. My name is Saba Ghazal. I'm a diplomat of the American Board of Periodontology. And today I will be talking about Crestal bone level change of narrow diameter versus standard diameter titanium zirconium implant for single tooth replacement. Randomization controlled multicenter clinical study. Natural healing following tooth extraction result in significant dimensional changes of the alveolar ridge. Ridge preservation can minimize these post-extraction dimensional changes, but resorption cannot be completely prevented by ridge preservation, and bone grafting might be needed at or before the time of implant placement. Another alternative treatment in case of insufficient bone available for adequate implant placement includes the use of narrow diameter implant, which might reduce time, cost, and the patient acceptance rate. But when it comes to narrow diameter implant, there is always a concern about the increase in the fatigue stress and the fatigue fracture. It has been shown in few studies that reduced implant diameter might result in the reduction of the implant resistance to fracture by an estimate of 25% compared to regular diameter implants. On the other hand, fracture of regular diameter implant is very rare. Therefore, when using a narrow diameter implant, it is advisable to try to find a stronger alloy. Rock Solid is a titanium 85% zirconium 15% alloy, which has significantly higher tensile and fatigue strength compared to pure titanium implants. Based on preclinical study, titanium zirconium implant proved to have up to 40% higher tensile strength compared to commercially pure titanium implant. The successful use for this implant could increase the confidence in the placement of narrow diameter implant. Several clinical studies has demonstrated the reliability and the safety of titanium zirconium implant in supporting both removable and fixed prostheses. The success and the survival rate reported in these studies range between 97 to 100%,